Dischem spent more than 90 million rand on diesel for generators in 2022, a 65% increase. The Pharmaceutical Retailer did see double-digit profits, but operational costs grew faster than revenue. We have Rui Morais, Dis-Chem CFO and incoming CEO on the line. Rui, thanks for talking to us. You are coming in as CEO at a difficult time when rising operational costs, some linked to load shedding, are threatening your future earnings. What's the plan?
Evening, Melissa. So yes, it is a challenging time. I think regardless of what elements of corporate South Africa you speak to, there are obviously significant headwinds. I guess it depends on your outlook. I mean, we believe that we are in a relatively resilient environment with respect to healthcare in South Africa. And if we look longer term, our ambition, which is to kind of build a healthcare ecosystem, plays directly into that opportunity. So the headwinds, as much as they are there, and they will be there in the short term, and you need to decide, what do you look at those from? Is it an optimistic lens where you focus on investing, for a greater good and a greater purpose, while you try and navigate and manage the headwinds that will most definitely continue and come in the short term.
So Dis-Chem launched its health insurance more than a year ago, saying that it would make insurance coverage more accessible. What has been the response to that this year?
So we launched that into the retail space. It was obviously us testing a market that didn't exist, very much a new market. And that market is, 12 million individuals that are employed but uninsured, and uninsured as a function of not being able to afford the entry price points of traditional medical schemes. So the medical insurance product is a out-of-hospital benefit-rich product. And if you think about those 12 million individuals, they're younger age profiles, so generally quite a lot healthier. And the take-up has been good. The gross written premium, if you annualize it, which is one of the metrics that we use to look at how we've entered and kind of how we penetrated the market, is almost at 280 million. So we're definitely comfortable that the market exists, and we continue to see record month sales after record month sales, which talks to kind of the momentum that's gaining in the space. So definitely a need for kind of lower cost healthcare, which inherently brings access to more South Africans.
So Roy, we are entering the winter flu season when many cash-strapped South Africans are visiting pharmacies to purchase medicine. Medical inflation is about at 13% at the moment. Are the price rises at Dis-Chem more than that?
No, they wouldn't. I guess it depends how you define medical inflation. Generally, the term is defined for the professional services offered. In the pharmacy space, many of our services certainly are informed by the pricing that we get from the medical schemes, and the medical schemes, using their market share, have contained prices relatively well. From a medicine point of view, I think it's important that genericization happens, so generic medication as opposed to original medication. The outcomes are generally very similar, if not the same, and the price point is much lower. So as genericization filters into the environment and into our market and continues to grow, it inherently reduces price. So that's obviously a positive, if you look at the medicine landscape. But certainly in our pharmacies, around winter time, we'd hold true to the ambitions of being kind of everyday low price, and that extends not only into pharmacy but into phone shop.
So Dis-Chem did concede earlier this year that it took a hit from some customer segments following the moratorium on the hiring of white South Africans. Is there a clear indication of any revenue damage? And secondly, is that issue fully behind the group now?
The issue is definitely behind us. We spoke previously about the impact on some of our chronic scripts. The nature of a chronic script is that it does influence you, or once you lose a chronic script, it influences you for 6 months. We beyond 6 months from that incident, and we're seeing the return of chronic scripts, which is testament, I guess, to the fundamentals of the brand, which is really this persistent focus on service. So we are seeing a recovery. There was an impact, quite difficult to quantify, if I'm honest. There was an impact in the second half of our financial year, but we're glad that it's behind us, and we continue to focus on kind of doubling our dispensary market share.
Thank you so much for talking to us, Roy. That was Rui Morais, Dis-Chem CFO and incoming CEO.